Hi, everybody. Dr. Lisa again with another conversation with an expert for Health Literacy Month. Today, we have one of our favorite doctors, Dr. Sara Horton. Hi, Dr. Sara.
Hi, Dr. Lisa. Thank you for having me again. I love being on your show.
Yeah, and it's also, I'm sorry we don't have any community members, but we have some questions from the community for you today.
Perfect.
But we'll keep having you back over and over again. So this month, because it's Health Literacy Month, we ask people for questions. What are those things you always wanted to ask, but were afraid to ask or felt you should know the answer to, didn't want to ask your doctor? So we want them to ask us questions, and then we can ask you guys, the experts. So for you, you're a cancer doctor, and so a lot of these questions are relevant for you because it seems a lot of people are afraid of getting cancer. It's one of the reasons they avoid going to the doctor or getting tested. Why do you think that is?
Oh, it goes way, way, way back. You talk to older people in your family, and there was just this perception that if you were diagnosed with cancer, one, you were going to die. Okay. Secondly, it was not going to be is there a fun death? But it's going to be a long, prolonged, physically difficult process. And so with that kind of, perception, people really did close down when discussions were about cancer because it was fearful. And there has been so much progress made in terms of treatment of cancer and the fact that we cure so many cancers if they're caught early. It was so important to get that information out to change the narrative about cancer. And one of the best things that's happened are these campaigns, that you see on television and in magazines talking about cancer and how important it is for us to recognize that if it's caught early, there's a high chance that we can get rid of it totally and you go on and live your life. Okay, it's not always the case.
Yeah, but it's really common now that if we catch it early, there are things we can do about it. I want people to touch themselves, right? So I want you to talk about that. We don't look at ourselves, we don't touch ourselves. So tell us how you catch cancer early. And what is the importance of touching yourself and looking at yourself?
All right. So like it's Health Literacy Month in October, it is also National Breast Cancer Month. And I'm a breast cancer specialist. So I love this month. If you can't tell, I've got my pink on and we all have seen these pink ribbons. But I say that because this is one of the most common touching recommendations that we make for women is to do a self-breast exam. But in general, the reason that we recommend that people actually get to know their bodies by touching is that when you recognize something is different because you've touched your body so much, you, and everybody's different, that you can bring it to the attention of your doctor sooner. Because if you wait to do that once a year appointment and to see your doctor, and your doctor's touching a lot of different people, they might not recognize that something is different on you. But if you once a month, and so for breast, so we'll start with breast, we recommend once a month doing a self-breast exam, and there's no magic to it. In terms of people get really caught up, well, how am I doing it right? And some people don't do it because they don't think they're doing it correctly. But it's basically, you've got tissue. We all know what breast tissue is. It's kind of a fatty tissue on top of our skin that makes up our breasts. When we're doing a breast exam, we're basically trying to smush that fatty tissue down so that we can just feel if there's a lump, something hard in there. And so you just go all over where there's breast tissue, and I tend to use the top of my fingertips because we're the most sensitive there, and just make circles and just cover the whole area. Okay.
But I think, Dr. Sara, some people feel weird about touching themselves. How do we get people to get over that? Like, this is natural. We all have bodies. We need to be in touch with our bodies. So what's your advice there for people to really get comfortable touching and looking at themselves?
Well, first, the first thing is like you said, this is something that's natural and normal. And if you think of it instead of a sexual way of touching, but think of it in a medical way. We all go to the doctors. We all have to be touched to find out if something is wrong medically. You're being your own doctor, okay? And so along with that, you're getting to know your body. And so the more you touch yourself and in a way that you're like thinking, okay, I don't feel it. Oh, look, I've got a little lump here. Well, like, let me try to remember that. And the next month you check. And always, if you felt something weird, number one, you can bring it to the attention of your doctor if you want then, and they can tell you if there's something unusual about it or not. But usually we say that if it's not growing, so the things that we worry about is if you find something and it's growing, if you find something and it's tender, if it ever starts changing how it looks on your skin, if you start seeing this red, oh, it wasn't red before, now it's starting to get a little black, and those are changes. And most things that are what we say benign, that we don't worry about, that are not cancer and never turn into problems, most benign things stay the way they are. Sometimes you'll have a little lump, like I've got one on my leg, and it's just, I don't know what that is, but it's been there all my life and it hasn't changed. And I don't worry about it. And it's something.
But I'm glad you're talking about the skin. I mean, because I have something on my arm, right? And
Yeah.
I keep watching it. It's been there for years. I have a birthmark on my arm.
Yeah.
So I think skin cancer is another one we need to talk more about, because if you're not looking at your skin, you don't know if something else changes. And if you don't know if something has changed, and
Right.
melanoma is a skin cancer we don't talk enough about. And
Yeah.
what's your advice there for monitoring your skin?
Well, because right, melanoma or skin cancer is on the top of the skin, is more common in non-African American or lighter skinned people. We tend to think that we can't get it and not to worry about it. And melanoma is a tough cancer to treat, so it's so important to catch it early. But we know that melanin, the reason that Black people or darker skinned people don't get skin cancer as much is because things like UV light from the sun and around us damages the skin and can cause cancer cells to start. We have a lot of melanin. Melanin is what makes your skin darker, and it's protective of UV light. So we have our own born protection from this kind of damage. But where I see as a cancer doctor, darker skinned people coming in with melanoma is with the palms of their hands. So any place skin cancer can occur. And usually it's a place that the sun hits more commonly, in, again, lighter skinned people. But it can happen on your palms. I've had a young woman came in, I'm at Howard, she was a student. She had it on her foot, the sole of her foot. And
how did she notice that and bring it to someone's attention? Because I could imagine people not looking at their feet, and that could just go on and on for a long time without anyone detecting it.
well, she noticed it changed. She had a little dark, and we all kind of have dark spots here and there, but I think she was a very dark skinned young woman, and the contrast of the sole of her foot and this dark mark that started to grow concerned her. I think she started getting a little pain too when she walked. It was more towards the ball of her foot. But all of those things, especially when you're young, I was so proud of her for coming in, because when we're young, we never think that things like cancer is going to happen to us. And so we tend to ignore a lot of things. But she brought it to our attention. It was caught early. I actually sent her to NIH for a clinical trial, and she was treated and she did well. So importance of one, not ignoring things that just kind of don't seem right, especially if it's growing or changing colors. Secondly, coming to your doctor, don't be afraid to go to the doctor. And sometimes for women, and especially older women, the fear of cancer, especially with the breast or anything, a lump, it won't come in because they're afraid it is cancer. And you just got to remember that cancer is curable if it's caught early. And so your best chance is to get in there sooner and have the doctor say, oh, that's nothing, or, oh, that's something, but let's move now and let's get it taken out and, cure this. Yeah.
Yeah, that's terrific. And I love the story about the young woman looking at the bottom of her feet, because I think, myself included, I don't look at the bottom of my feet that often. And so it just is a reminder that we really need to pay attention head to toe to what's happening with our bodies. What's your advice for people who may live alone or not have people they feel comfortable with looking at their body? Because, for instance, our back, it's hard to look at your back or examine what's going on back there if you don't have a loved one who can do it for you. But that's part of the, self-assessment.
Right. So if you really don't have anyone you're comfortable with, and so you might need to rely on your doctor, making sure that you have somebody who knows what they're doing. If you're not looking at it that often, make sure you have someone who, when they look at it, they know what they're doing. And so dermatologists, skin doctors are called dermatologists, and they do something called a skin survey. And I just say, I go in once a year, for my skin survey. Now, you don't have to, you can ask your primary care doctor. They know how to do it as well, and say, look, you know what? I can't see all of my skin, and really there's nobody else looking. So if you don't mind just kind of taking a better look at my back. The other thing that I do, if you've got someone who you're comfortable with, to take a picture. I take once a year a picture of my back or anywhere that might have something I might be a little worried about, because you don't remember how big it is or what. And I'll put it in my phone, and I have a little album where it has the pictures of this area, and you could go from year to year, and you can even show
You're so organized. Most of us, myself included, are not that organized. I would take a picture and forget where I put it.
Look, that's because I'm unorganized. I had to get tricks to be organized. Yeah. But I've got them for all my family. I got my dad's, the places on him. I got my mom's.
Wow, wonderful. So, this raises a really important issue. I think we need to remind people, doctors nowadays, they're not doing a complete physical exam. Sometimes I've been to the doctor's office with both my parents, and sometimes they don't even touch you.
Yeah, exactly.
And I think, this is not great. So we trained in a time when the physical exam was really important. It was before we had all these fancy imaging and all these innovative techniques to look inside the body, but it's still really important to do a physical exam. So I think if people are doing their own, really learning their bodies, they can take that information to their healthcare provider and say, hey, I saw this, or I noticed this. Can you take a look at it? Because I think people have to be proactive nowadays to get a doctor or a healthcare provider to actually touch them, which is very sad to me.
You are absolutely right. And it's interesting because I went to an appointment with my 82-year-old mom, and the doctor did not touch her. And I was like, wow. So, and I tell patients this too, because it's happened to me. Not that I like to touch patients, so I would examine, but sometimes you don't do the whole exam, every time you see them. And you should say, if you are ever in the doctor's office and you're waiting because there's something you're worried about, and you get to the end and they haven't touched you, you're like, oh, I'm about to leave here and maybe next year. No, you stop and you say, doctor, I have this lump in my neck and I'd like you to examine it. Or, you know what? Could you listen, even if you don't have a problem, if they haven't listened to your heart or your lungs, you say, could you listen to my heart and lungs? And that will shame them, first of all, and get your exam done, because you shouldn't leave without some type of evaluation where they're physically, even if it is just listening to your heart and lungs. But yeah. Oh, you're muted. I can't hear you.
Well, Dr. Sara, this is really great. I think we have to break this into part 1 and part 2.
Okay.
So for today, that was really terrific. We also need to talk about how you catch cancer early and what you need to do to prevent cancer. So for now, thank you very much, and we'll talk to you again soon.
Okay, can I add one thing? Everybody, every woman, I want you to go out there and grab somebody, a friend, a relative, and you all make a date to get your mammograms done, okay? Buddy, just do it. Have fun, go to lunch, make it fun. Okay. Okay.
Yeah, I love that.
All right.
All right. Talk to you later.
Okay, see you later. Bye.